So, I mean, I've taken your class before and you've talked about your relationship to health psychology. And one thing that stood out to me when you were talking about your experiences at the Virginia Commonwealth University and at the Virginia Treatment Center for Children is the multifaceted approach that you had there. So before I ask my next question, would how would you classify yourself, if any classification, in terms of being a psychologist, i.e., clinical psychologist, health psychologist, etc.
Yeah, I think I'm a clinical psychologist that while trained as a scientist and as a researcher, I think the individual whether it's patient or colleague or student that interfaces with me also hopefully senses the humanistic orientation to my work, and that certainly the empirical aspects of it are important and are foundational, but equally important, and maybe even more important, is that it be rooted in a humanistic orientation with a through a humanistic lens to be able to use that as a guiding force in the way in which one works. And so I hope, my hope is that's what comes across in the way in which I teach, in the way in which I care for my patients, and in the way in which I engage with, other folk in the community.
Thank you for sharing. And can you explain how you landed on that approach to clinical psychology that is more humanistic rather than empirical?
I think it found me. It certainly was the way in which, my it's the way in which my father raised me and the way in which he practices as a psychologist. Um, I think I think I kind of went full circle in as much as the program that I attended at VCU was a very heavy scientist capital S practitioner, and so really the formation was one of to be a future researcher, a future faculty member at a research university, and I stepped into that apparatus and did what did what researchers do, and did what clinicians that work from a strictly empirical paradigm do, which is you become an expert on the literature and apply it accordingly. And really wasn't until year two in the program that I took a counseling theories course that sort of opened my eyes to that there's a world outside of empirically oriented approaches that I think informs the other aspects of the work. And then I think connecting that with uh, my upbringing, connecting that with being able to see how my father put it into play in his practice, I think informed who I am today. And hopefully, I've been able to integrate those aspects into my identity as a psychologist, and it's what's best for my patients.